Hi, good afternoon. Again, after almost a week or so, I'm making a video. I missed you guys. I really like making videos, and especially when I get messages. Like today morning itself, I got a message from Brazil. I just woke up, and normally I don't see my phone until an hour later because I just want to have good thoughts, and I'm planning my day, and I want to manifest some things. But I woke up and it was just 10 minutes or so, and I was like, let me just on my phone. I don't know why I did that. And I had a very nice email actually from a Brazil by some doctor, and she was saying that she's been preparing for ADC for quite some time, and she recently came across my videos, and hence, since the day she's come across my videos, she's trying to watch every one of them, and that she told me they were so nice and new insights she was getting, and she's so thankful for that, and that I should keep making more and more videos because it helps. That was such a good motivation. And since that time, I was like, okay, let me find a time in the day where I can just do it today because you know how my life goes. I like try to share as much as I can. So finally, my son is fine by God's grace. Thank you so much. That was such a pain. So he's fine now. And my maid has also returned from her annual leave. So, yeah, two things together is like I finally feel like my normal self. So yeah, today I could manage to sleep and then finally going back to my normal hormonal self. Otherwise all my hormones were all over the place because it was stress, fatigue, work, child, him not being well, so many things going on. So things are coming back to place. Uh, got decent time to speak to my mom also. So yeah, so things are going back to normal, and that's good. So I thought let's shoot one more video. And just the other day I was thinking that I've got a couple of new books from India that I had gone to, and they're really lovely books. And one of them is about good quotes. This person called as Demi Lovato has shared. I will share with you. So I thought, why not I share some quotes with you all, which would help you all to motivate or just feel good. Because the other day I was just reading on Facebook, those reels come and some quotes come that everybody in this world is so fixated at the moment, doing so much savage roles and inhuman things like the films and etc., making it so gross and violent. Like, this is not how we are. We need more compassion and kindness and peace, most importantly, to progress. Like, you cannot progress with lots of anger and raging emotions. Only destruction is going to happen with that. So I was like, that is so true. So when I was reading this book, I'm like, yeah, this is what we need. A little deeper conversations, a little deeper touch to acknowledge that we indeed belong to a more peaceful place, and that all we want to do is just be content with what we have and grow peacefully in our own lives. So I was like, I'll just share one quote and speak a little about it. And it's always nice to connect. It's you guys who message me your life stories, which makes me feel sharing mine. So thank you for that. I really appreciate when you email and message me. It's freshness for me as well, knowing what is happening in some other area in the world, because otherwise you pretty much get stuck, especially a person like me, in just the work and home and family life. With a couple of night which I go out with my friends, and we just discuss almost the same things. So anyways, let's start with this question, and then later on we can chit chat again. So today we are on the second SBQ of the SMOC 21. Let's see what the question is. A patient who received a post and core crown treatment or maxillary right central incisor 5 years ago is experiencing looseness in the crown. Okay, this is not exactly the maxillary right central incisor out here, but a similar picture that I could get. In the exam, we'll have the appropriate tooth matching the picture. So this is how the patient comes to you. and which investigation will be helpful in diagnosing the issue. So basically, the patient comes to you with this state and says, I had a post and core with a crown. You open the mouth, there is no crown, there is no post and core. And you're like, only this piece is there. So now you want to determine what you should be doing. So, what is the first thing that would you do? Let's see. Vitality, post and core means an endo treatment was done. Okay, an endo treatment is done, so the pulp is not there, it cannot be vital. Probing, okay, let me come to that later. Percussion and OPG. OPG, I would not say. IOPA, maybe I would have chosen that answer. Percussion. See, percussion I would try and do to assess the status of the periapical tissues. Percussion is always a test for that. It's for the periodontal ligament. It's not for pulp ever. You understand that, okay? You have to see the periapical status, and that is what percussion is. That people often confuse it as a test for vitality. No, it is not. A tooth can be vital and still have POP positive if he's having periodontal issues. Okay. Probing. Why probing is important, and why would that be my answer of choice? If I was to go in hierarchy, I would have chosen probably probing and IOPA, or IOP and probing, either of it. See, probing will help you determine if there is a pocket. Because if there is a pocket and if you do detect a fracture line, then pretty much the prognosis of this tooth is hopeless and all you have to do is extract it. Now, post and core teeth are highly susceptible to fracture. Why? Because see, already it's a root canal treated. It's a brittle tooth. And then you're putting a screw inside it. And if that screw has not gone in the canal space properly and it's gone, you understand, on the lateral walls, there is a high tendency for it to fracture, or if a ferrule effect was not given. I hope all of you all understand what ferrule effect means by now. Ferrule effect is, you know what, I've opened, I think, yeah. So focus on my arrow here, okay? For those people who are still confused about what the ferrule effect is. This is the tooth, okay? And here is your canal opening, and you've put a post, and this is the core. Now, if this is the level on which your crown is going to come like this, then it tends to move here and there and can result in a fracture in the lateral directions. But ferrule effect means what? You dig down a bit more, you reduce gingivally more tooth structure, basically prepare the tooth and create a nice collar-like area 360 degrees. And then the crown is resting over this part, like the crown will come like this. So the crown is not resting at this position, but it's resting on a sound tooth structure. You understand? It's not on the core that the crown is built up. The crown is built up on the tooth structure, a sound tooth structure, not just the core of the post and core. This is what you have to understand. That is called as a ferrule effect. The crown resting on a sound tooth structure, which is nothing but a 360-degree collar of a sound tooth structure on which the crown is there, not on the metallic core. As simple as that. So whenever a ferrule effect is not given, meaning whenever the crown is resting on the core of the tooth, that is the core of the post and core, the metallic portion, then there are more chances of it moving laterally and fracturing the tooth. So that is what I mean basically. So now that we have these concepts clear, and yes, you will definitely get a question like this in your exam, post and core. They are very commonly done, and you will encounter one in your exam because you will encounter one in your daily life practice as well. So, what could be the cause of dislodgement of the post and core that has the least favorable prognosis? Okay. So, what the question is basically asking is, which problem of post and core that may result in will cause the least favorable prognosis. Least favorable prognosis means what? Things that you cannot correct, and probably you'll end up losing the entire tooth. Losing the entire tooth can only be extraction. There is no other way. So it's a pretty much straightforward question, but still let's look at the options. Crown lengthening, okay, because of that, crown lengthening is not going to make you lose the tooth. It can result in disgorgement of post and core, but it cannot make you lose the tooth. Crown lengthening and orthodontic extrusion, fair enough. Better post fabrication to a certain extent. Gingivoplasty is again like crown lengthening or repositioning the gingiva. But all of these things are not going to result in loss of post and core, resulting in extraction of the tooth. So the answer here is extraction because that is the least favorable prognosis. Now, the placement of a post in endodontically treated tooth with minimal coronal tooth structure provides. Placement of a post in endo-treated tooth with minimum coronal tooth structure. What do you mean by minimal coronal tooth structure? It means you have not reduced the tooth structure a lot. So, or rather, actually, it means the height of the tooth is very short and you don't want to remove more of the tooth structure. So basically, the height of the tooth is very tiny because of the fracture or caries or whatever. And you know that the crown is not going to retain on such a short heighted tooth. So you are putting the post on it to get what? It's more retention for the core, basically. Because if the tooth structure is very short, the crown won't stay on it. And if I want my crown to stay on it, I want the height of the crown to increase, and the only way to do so is to give a core, but core by itself will not stay, so I'll have to give a post. So that is what the question is asking. The placement of a post in an endodontically treated tooth with minimal coronal tooth structure is providing what? It is providing retention. Many people I know have marked here as a ferrule effect or a resistance to root fracture. You did not understand the question. Get it? First of all, a post is not going to provide a resistance to root fracture. In fact, you're eating away more of the tooth structure. It is detrimental, but you are just doing it so that the crown can stay properly. Reinforcement of the root structure, no. Again, the same funda, you're removing more of the tooth structure to put the post, so you're not reinforcing anything. The only thing you're doing the post is to increase the length, the height of the tooth so that you can give a crown. A ferrule effect. Ferrule effect we just spoke about. You actually are digging more in the tooth to give a sound tooth structure for the crown, not the post. You understand? So the post has got nothing to do with the ferrule effect. It's purely for the crown. Retention of the core, and that is the right answer. I hope this prosto concept is clear after this explanation and that you further will never have a problem with this. Still not understood? Pause, rewind 2 minutes, and listen to my thing again. For a longer time, even I was confused with the ferrule effect concept, but once I really understood, because somehow the definition was a bit confusing and I wasn't understanding. So I have explained here in the most layman of all terms. If the tooth is extracted, what is the best method? Keyword best method. When I have said best method, it means that all the methods that would be given in the options would be correct. I have to choose the best among them. Now the question is asking which is the best method and which is long lasting. So I have two keywords here, best method and long lasting. Now if I'm going to extract a tooth, what are my methods of replacement? Implant, fixed bridge, cantilever bridge, RBD. All four of them are correct. I can use all four of them. Now which is long lasting? Let me filter out this one. Long lasting, I would go with a fixed bridge and an implant. Now which is the best method? Now, when I say the best method, I have to see which would conserve my tooth structure. Now, in fixed bridge, I would definitely have to reduce adjacent teeth structures. But in an implant, I don't have to destroy the adjacent teeth structures. So thereby that would become my best method. So you see how I filtered out, I first filtered out the long lasting because I didn't want to jump on the best one because I need to see which is my good option, which is a long lasting. So first it's better to eliminate the long lasting one, which we did, and then we went on to the best method. This is how you should train your mind. Now again, this will come only through practice. It didn't strike me also at first go, but anyways, like I mentioned, when I had given my March 2022 exam, the only paper and that too few questions of it that were available was of September 2021, and the pattern had just changed in September 2021, so nobody was pretty much aware. So it's only when I solved few of those questions that I realized what ADC is looking after, and I banked on heavily on my concepts of understanding dentistry and my clinical practice, and that's how I could clear my exam. And when I gave my own exam and I saw the questions, I understood what the ADC wants, and I really appreciate their part one as much as I abhor their part two exam. The communication OSCE part is good, but it's not transparent. The technical part, I don't like it at all. The skilled OSCE part is decent. But the part one exam, I really admire because that is the right way to study. And I wish all the dental students were taught this way in their academics because it's so clinically oriented. But again, it's not completely transparent because, like I mentioned, 40 questions are unmarked, meaning 40 questions will have more than one answer correct, and they cannot give two answers correct, so they remove them for scoring. So from 280 questions that you will be attempting over a span of 2 days, you will be marked on basis of 240 questions only. So that's why don't beat you all up if you find two answers correct. Just mark whichever you feel is right and move ahead. Because probably if you're going to break your head more on the question which has two answers correct, it's probably an unmarked question. So might as well waste your time or rather utilize your time on question which sure short have one answer correct. So yeah, that's about this question. And so what are you going to do after this video? You're going to read more on post and core, brush up your concepts about ferrule effect, brush up your concepts about type of posts, and read a little bit of implant. Prosto, a lot of people message me that their prosto is weak. Very understandable because in your internship and in your fourth year, all you have been taught is how to prepare that one tooth to give an exam on. CPD is rarely taught, and yet ADC asks so many questions about CPD. We barely understand the attachments, the clasps, the arms, and the direct retainers, indirect retainers, the Kennedy's classifications, the modifications of it, and implants you probably have seen. Most of you must have not even performed it. It's difficult to understand which diagnostic methods go into understanding which implant has to be placed where, what anatomical landmarks you're supposed to determine, what is that peri-implantitis. So go on slideshare.net, just write implants in dentistry. You'll get many presentations made by third year, fourth year BDS students, which are very detailed, elaborate presentations, very clinically oriented. So you don't have to open a textbook and be bored by reading it because the key points are given in the presentations. Go through three or four of them presentation on the same topic, like example, just type CPD in prosthodontics or RPD in prosthodontics and go to three, four different presentations. Yeah, it's gonna take like 2 hours or so, but you will be more confident about the concepts then. Wow, it's already 3 o'clock out here. I have to leave for work in like half an hour. So this is how only your prosto can be helped. Otherwise, it's impossible for you to read that Stewart book and the fish book and the for implants and blah blah books for other things. They're thick books, you know. Yes, you can read if you have time, but you don't. You can read in your future when you have time and you're not doing any exam to become a better clinician because of course those books will help. Knowledge is never a waste, but at the moment let's just focus on the exam and do smart work because time is less and you have to know so many things that you cannot just focus on one subject and forget about the rest because prosto may be your weakest, but I'm sure peri-oral surgery are not your strongest subjects either. So you have to brush up those as well. Plus, read more on infection control from their textbook, which I've already shared. Yeah, so that was about EDC, and hopefully I make another video tomorrow. Coming to this nice quote. So this is the Demi Lovato book. It's really nice, you know. It is staying strong 365 days a year. And basically, she's given quotes of her life experiences. And one of the quote that she wrote is, "We are all just works in progress." Uh, it is such a simple quote, and yet it is so true. So it's nice. A small paragraph she's written about it. Nobody ever said you have to have it all figured it out, because I promise you nobody does. That's true. Nobody can have it all. My own example, you just cannot have it all. You think you can, you can't, and you have to make your peace with it. And every time you feel, okay, I could have done this better, but I'm still a work in progress. What matters most is to keep working on yourself, keep allowing yourself to heal, to grow, learn, and stay humble. Whenever you feel like your work is done, start all over again and remember that all of it is worth it. So, yeah, whenever you feel like giving up, restart, reboot, refocus. And this is what I do. Like, for example, today, I don't know, since past 2 hours, I was feeling a really low for I don't know what reason. Just called up my mom and I was like, Mama, I'm really feeling very, very low. And she was like, it's okay. You know, she spoke to me for a while and then I was okay. So, yeah, that's about it. And I got another book. I'm going to start reading it. It says Why We Are Who We Are. I think I'm at that stage of life where I'm wondering, what am I doing on this planet Earth? I know when we were kids and when we were in school and college, we had goals. Okay, we have to graduate, we have to work, we have to earn, we have to have a home, a family. But when you have it eventually in different timelines, then what? Then pretty much all your desires are fulfilled, and then you just keep working as a means for the greater good, as a piece that God wants you to work on for others. But sometimes you do wonder, okay, why are we still here? Probably I'm in that phase, and I was just going through the bookstore, and I just happened to have this book, and I was like, okay, let's go and read. Let's see what answers I get. And if somebody has written this book, probably that person was going through the same state of mind as I am. Somewhere I'll relate. So I'll let you know how I find this book. I mean, of course, I'm going to take some time, but some nice concepts if I come across, I'll share. You all also share nice quotes from your life, which makes you go through in life. Jot it down, like write in the comments. It's really nice to have a nice communication. Or just DM me on Instagram. It's Dr. underscore Garima underscore Khandelwal. Like just DM me. Just share. It's nice to connect in your own colleagues. Let's spread the positivity among the dentists. So, yeah, have a nice day and see you back. Bye bye.